Welcome back, YouTube. This is Steven from Steven and Tosh, and I'm in full doctor mode here to address some medical, or to record some medical type content. First off, this will be a series of 4 different videos. The first, which we're going to record, I'm going to record now, will be basically addressing the question of what is a DO. Now you can see my jacket here, and this is my name, Steven Jackson. I am a DO, also a general surgeon. That's my chosen specialty. After this video, I'm going to do 3 others. One will be the questions I'm most often asked by aspiring medical students. The second will be 5 most asked questions from medical students. And then my last will be 5 questions or 5 things I should have been thinking about as a resident. So first of all, what is a DO? The reason this question, or this, basically the motivation for this video, is I recently got an email from AOA, that's our governing body, the American Osteopathic Association. And apparently there were some things that were said by a CNN news anchor that were incorrect in terms of, I guess, a DO. As you probably know, Trump has contracted COVID, and his actual physicians in the hospital were DOs. If you looked at their lab coats, you would see at the end of their name they had the DO, which is for Doctor of Osteopathic Medicine, or Doctor of Osteopathy. I don't know what was said specifically because I've tried to find it and could not, but basically the anchor made it seem as if the doctor was some type of alternative medicine type of physician, which is incorrect. And so I figured if a national anchor of a large national news network doesn't know the difference, or doesn't know what a DO is, then I'm sure most of us don't as well. So that's what prompted this video. Now, first of all, let me say, you have probably been treated by a DO, or you know of one, or some of your family members have seen one. But you probably didn't even know it, because as far as actual practice is concerned, there is no difference. For the most part, you'll find a DO that is practicing exactly the same as the MD counterparts. So, taking a step back, there are 2 types of licensed physicians in the United States, meaning 2 types of physicians that can practice all areas of medicine, from prescription of medication to performing surgery and everything in between. They are MDs, referred to as allopaths or allopathics, or MDs, or DOs, which are osteopaths. That's it. You have other areas of healthcare, but as far as 2 state, national licensed physicians able to practice all areas of medicine, including surgery, it's just MDs and DOs. That's it. So, DO. The DO concept, or the DO philosophy, is basically treating the entire body, not just treating symptoms, taking the entire person into account. Physical, spiritual, emotional, bringing everything in to try to treat the problem and cure the problem. Andrew Taylor Still, he is the founder of osteopathic medicine. He himself was an allopath, MD. He actually had a very tragic story in that his wife and 3 children all died of spinal meningitis. And so the story kind of goes, this obviously he watched his children and wife die. He's a doctor and could do nothing about it. So after that, he began to think there's got to be a better way. There's got to be a way to treat people, because what we had at that time didn't work. In fact, a lot of the medications that were being used at that time made matters worse, made the patients worse. And granted, it was back in the 1800s, and yes, there weren't a lot of medicines to cure or fix things. So in any event, he at this point kind of started thinking about different ways, alternative ways to treat patients. And he was kind of the first physician to kind of go in the direction of preventative medicine, so prevent the disease from happening. Now, this day and age, that's a common belief on both sides, MD and DOs. And you'll even find a lot of MDs, excuse me, who practice, including the entire person. Because that's something that has recently, or not recently, but definitely in the last 20, 30, 40 years, has come into, become popular. And you'll find some DOs who just prescribe medications and don't try to get to the root of the problem and fix the problem. So, as far as training is concerned, MDs and DOs have the same training with one exception. DOs have a second course or discipline where we learn manual techniques. Now, these manual techniques fall in the areas of kind of massage, manipulation, strain, counter strain, basically musculoskeletal treatments that don't involve medication but more manual techniques. I guess the easiest way to kind of relay it would be that chiropractors adjust bones, so the popping and the cracking. It's called high velocity. We learn that as DOs. And there are some DOs who practice just manual medicine. There aren't a lot, but all DOs learn it. So with that one exception, all the other classes are exactly the same. The pharmacology, the pathology, the physiology, the anatomy, all of it is the same, DO and MD. Once a DO graduates from medical school, he can choose a residency. He or she can choose a residency. That will last 1 to 7 to 10 years, depending on what they choose to do. That's exactly the same as MDs. In fact, over the last couple of years, the MD and DO specialties have kind of come together to just have one specific training governing body. Before, you had DO residencies, you had MD residencies. DOs could get into MD residencies, but not vice versa. I think now they're trying to combine them all so that there is a standardized training for both sides. And that's something that has, over the last couple of years, has come into fruition. After that, you have to take after you finish your residency, you have to take your board exam to become board certified in your specialty. Same thing with MDs. You cannot practice medicine in the nation or in your state without a license. That license only comes by having accomplished the preset requirements, which are finishing your residency, taking your board exams, all your licensing exams, all those things have to be in place. So, as you can see, there is no difference between the two. The president's physician is a DO, and he may or may not know what that means. The country at large may or may not know what that means. There are schools, new schools coming up all over the country. Chances are, if there is a DO school in your state, then chances are you have seen, or someone you know has seen, a DO, and probably not known it. DOs, as far as the schools are concerned, really try to focus on primary care. They try to not only focus on primary care, but primary care to the underserved areas. So when a school comes up in a state, they basically come up with the purpose of providing primary care physicians to the underserved in that state. Primary care physicians are your family practitioners, your general internists, your obstetrician gynecologists, and your pediatricians. So that's also another focus of the DO schools. DO schools also tend to take the untraditional student, the student who may have worked for a few years before applying to medical school, or the gentleman who, or the lady who worked 15, 20 years and he or she's in their 40s and wants to go to medical school. A DO program would seriously consider that type of applicant, where in times past, from what I've been told, some MD schools were not that lenient in terms of that, if you want the traditional student. It's also been said that Andrew Taylor Still in his DO school was the first to actually allow women in the practice of medicine as far as becoming DOs before it happened in the allopathic world. So that's it. That's what a DO is. Please stay tuned. We'll have more videos to come. If you're an aspiring medical student, if you are a medical student or a resident, you might want to subscribe to the channel, Stephen and Tosh. And once you subscribe, you'll hit that notification bell and you'll be notified when new videos come out. And we look forward to seeing you. Take care.